Welcome to your pre-surgery joint replacement education. Your decision to review this presentation will assist you to have the best outcome for your surgery. Good job. Please take your time and remember, your surgeon knows you best. Always follow their instructions, which may vary from our general discussion. That is okay. You should write down any questions you have. You are invited to call us or your doctor's office. You can stop at any time, move backwards or forwards. We will be reviewing each slide, but there is much more information you may want to jot down. We will be discussing knee, hip, and shoulder replacement surgeries. You can skip the joint replacement that is not your surgery. We will share a lot of information. Do not be overwhelmed. We are here for you. Take a seat, grab a drink and a snack. Let's begin. Let's begin by discussing the objectives for your surgery. First, you need to prepare for surgery. You have to understand your journey and your procedure. Then let's learn what to expect during your hospital stay. Please know, mobility the day of surgery, which means you're up and moving right after surgery. Also, we will discuss the keys to a successful recovery. Please prepare for your discharge and to go home. We have a very strong commitment to you. We're going to provide an exceptional experience to get you back to your active lifestyle. We have several specialty board certifications. We are certified by the Joint Commission for hip and knee replacement surgeries. We have multiple health grades awards, and we are among the safest hospitals in the region to receive care. We are nationally recognized by the Leapfrog Group with an A safety rating. But remember, you play the most important role and are in control during your recovery after surgery. Let's set some goals. You need to think about short-term goals after surgery. What are your long-term goals? And what is the plan to reach these goals? Let's prepare for surgery. Registration. You have to complete this process and all of your pre-admission testing before you have surgery. This is done at the main hospital and the Thousand Oaks Surgical Hospital. Please do not miss your final pre-surgery visit with your doctor. If you do, your surgery likely will be canceled. It's very important to discuss all medications you are taking with your surgeon. Some you may be required to stop. These medications include any aspirin products, any NSAIDs or non-steroidal anti-inflammatory medications, and any anticoagulants or blood thinners. Discuss all medications with your surgeon to include any vitamins or herbal substances you may be taking. Things such as ginkgo biloba, vitamin E, etc. They may interfere with your surgical outcome. Also, if you're seeing any specialty doctors, such as someone to help you manage your heart, diabetes, pain, seizures, or kidney function, let your surgeon know so they can have a conversation together. Your surgeon may have you participate in an Enhanced Surgical Recovery Program, or ESR for short. This program requires that you drink only clear liquids after midnight, and you may be given a designated extra drink to take. Please follow any other instructions that come from your doctor, such as taking Tylenol before your surgery. Your surgeon may also decide that you should be NPO, meaning nothing by mouth, before your surgery, so do not eat or drink anything after midnight. Again, please, no perfume, nail polish, makeup, or lotion on the day of surgery. Leave your valuables and all your medications at home. At your preoperative surgery visit, you will be given a kit which will contain a chlorhexidine bathing or CHG soap. This soap reduces the risk of any infection after surgery. It's normal that we have bacteria on our skin. It keeps it healthy. However, when we have surgery, we don't want that bacteria to go inside of the body. So this is why you will be asked to bathe with this CHG soap. Hopefully, we can do this for a total of 5 days, including the day of your surgery, depending on when your surgery was scheduled. You need to shower as usual with your soap and do your hair, Then apply from the neck down the CHG soap. Please avoid your private areas because it'll burn really bad. You need to leave it on your skin for at least 2 minutes. So I don't know, sing, do a dance, whatever you like to do in the shower, and then rinse it off. It's also a good idea to change your sheets the first day that you wash with the soap and then the day before you come in for your surgery. It's always nice to hop into a clean bed. Please do not shave your legs 3 days prior. And also, if it's your shoulder, do not shave your armpits. Shaving does open the skin and creates an area that infection can come on inside. Also, again, no makeup, lotion, powder, perfume, hair products, and deodorant on the day of your surgery. We are going to screen you for MRSA and COVID-19. I'm sure everybody has heard about this. This will help us, again, to reduce the risk of surgical site infections and postoperative complications that can be associated with that. We do not want infectious organisms to transfer into your incision site. An infection is going to make your recovery difficult and it's going to delay your ability to get back to your life. During your pre-op visit, we will use a nasal swab for each test. Our goal again is to schedule 5 days before your surgery. Please note, it is expected that you will quarantine yourself from the day tested through your arrival. This means you're going to stay in your house with the people that are in your house. Please do not go out into public areas where you can be exposed to the COVID-19 virus. Your physician may elect to treat MRSA risk prophylactically, meaning they might treat you anyway, even though they do not have the result. It's not uncommon for people to test positive for MRSA. Positive COVID-19 patients will not be able to have their elective surgery as scheduled. You will be directed back to your surgeon and we will take the necessary steps to retest you and you'll have your surgery in the future. Smoking is very harmful to your body. It hurts our lungs, heart, and blood vessels. It will slow the healing process. Please know that nicotine competes with oxygen 1-to-1, and we all need oxygen to be able to heal. It is very important that you stop smoking. If you smoke, please discuss this with your doctor so you'll be in the best condition for recovery after surgery. Here's some things you need to consider. Who's going to help me at home? Do I have family, friends? Where will I go after surgery? Am I going to go home with the help of my family or friends, or am I going to stay with them at their home? You may have home health or occupational physical therapy. Be sure your designated caregiver is available for transportation home. We have to discuss this with them. You may assume they know that, but they need to make time in their schedule also to be able to pick you up. Please follow up with your surgeon within 2 weeks. Make your appointment before your surgery. Your expected length of stay, if your knee is replaced, 1 day. If your hip is replaced, 1 day. If your shoulder is replaced, 1 day. Please take note of this. You may speak with someone that says, 10 years ago, I stayed for a week. That's not the way it is anymore, so be ready to go home. Your expectations after surgery. You are going to perform home exercises twice a day or as directed by your therapist and your doctor. It's good to walk daily, gradually increasing the distance that you walk. You need to change your positions frequently. Do not stay in the same spot for too long. If you're given precautions, you need to remember them. It's important to eat a healthy, balanced diet. Also a good idea to increase your fiber and add at least 8 glasses of water a day, unless you have a fluid restriction. Also, if you can increase your protein intake and vitamin C, you're going to put your body in the best spot to be able to get well fast. Let's talk total knee replacement. If you're not having your knee replaced, remember, you can go forward from this slide. Let's understand what's happening here. If you take a look, you can see what your diseased knee looks like. That's why you have been experiencing difficulty with movement and pain, because the bone is just grinding on your bone. What your surgeon will do is going to reshape those bones and then will place implants that are going to act like brand new surfaces to those bones, and your knee is going to move beautifully. Here's some things that you need to do. Gently bend and straighten your knee with exercises and walking. Heel slide is a great exercise that your therapist will work with you on, and you can continue to do when you're home. Dangle your feet off the bed, kind of gets them moving. And you can place a small roll under your ankle, but do not put a pillow under your knee because that's going to restrict the blood flow and your foot's going to swell. Let's talk about your hip. Again, if you're not a hip, you can go ahead and move on past this one. Your hip joint is a ball and socket. You have the ball part of the top part of your leg or your femur, and then the socket that is in the hip joint. What happens is that area becomes broken down. So you have bone on bone rubbing together. It becomes very painful, limits your mobility, and can even make you off balance. Your surgeon will be able to create a new area by taking out the bone that is damaged and shaping it so that when the implant is put in place, it's going to move like it moved before it was ever damaged. Your surgeon may decide to do your surgery using an anterior approach to your hip replacement. If this is the choice, you may be asked to follow some of the following precautions. No bending backwards, no pushing your hips forward or bridging, no lying face down, and no twisting your legs outwards. If your surgeon decides to do your surgery posterior, you may have the following precautions in place. No bending past 90 degrees, no twisting your legs inward, and no crossing your legs. Let's talk about your shoulder. If you are not having a shoulder replacement, remember, you can pass through this area. The shoulder is one of the most difficult joints to repair. Your surgeon will look into the area, remove any damaged bones or structures that are in there, but understand your shoulder kind of sits in a free-floating type of socket, which is why you can move it 360 degrees in a full circle. Therefore, this joint becomes a little different when we heal it after surgery. The shoulder replacement procedure will take the damaged bone parts out, and then your surgeon will replace them with beautiful new implants that are going to make it so you can move your arm the way you did before and be able to do the things that you always did, such as bathing, combing your hair. There are precautions for your shoulder for at least 6 weeks. Again, understanding this is one of the most difficult joints to be able to rehab, so please follow these directions. Do not actively move your operated shoulder. This is when you create the muscle power to move at the shoulder joint. There will be swelling that needs to decrease so that the joint can heal. Do not lift or carry items with your operated arm. Do not carry any weight with your operated arm or shoulder. Please do not reach behind you. Always keep your arm in a position where you can clearly see your elbow. You will be given a shoulder immobilizer. Wear the immobilizer at all times until told by your surgeon it's no longer necessary. Remove this only during bathing, dressing, or exercises. Your hand and wrist should be supported. Position the arm in the shape of an L to prevent a pulling sensation on the shoulder. It should relax on the immobilizer. Let's talk about the day of surgery. Your hospital stay. You will have a wonderful team to be able to take care of you when you come here. This team includes many people, such as your surgeon, the anesthesiologist, a hospitalist who is a doctor that specializes in taking care of people while they are in the hospital, many registered nurses, certified nursing assistants, a physical therapist, possibly an occupational therapist, dietary experts, and a case management nurse to help you to get ready to go home. Here's some things you should expect. You will be out of bed the day of surgery, likely when you arrive to the unit. The expectation is that you will be out of bed for all meals. You don't eat in your bed at home, so therefore you shouldn't expect to eat in your bed while you're here. You will be walking in the room and the hallway. You may have an assistive device if it's indicated. You are expected to participate with PT and OT and optimize your pain management. We will look at what your functional goals are. What do you need to bring to the hospital? Bring your insurance card and an ID. Please bring any information given to you by your surgeon. If you have an advance directive, please bring that with you also, and we will copy it and place it into your medical record. Leave your valuables at home. Do not wear any metal products such as hair clips, bobby pins, or jewelry. Do not bring any personal computing devices. You will need to secure your cell phone and charger. Bring and secure your dentures, hearing aids, glasses, and their cases. Please do not wear contacts. Please bring a list of your current medications and include in that list what the dose is, how often you take them, what is the last time you took them, and who the doctor is that prescribed them. It's good to prepare this ahead of time and just do a sheet that lists all of them. We will review all of your medications preoperatively and before you go home so that you will be safe with what you are taking. Your joint replacement information, anything that you have gathered that you want to bring with or you want to discuss with your surgeon the day of surgery or with the team. Please bring personal clothing to change. Let's remember, you're not sick. You're having surgery to improve your mobility and quality of life. So we expect that you will get dressed each day as you would do at home. It's a good idea to bring shoes that are rubber soled that are not going to slide, like sneakers or walking shoes, not sandals. Bring loose athletic shorts or pants. You don't want to have any tightness around your ankles or around your waist. Loose-fitting shirts and undergarments are also suggested. Remember, you will be up the day of surgery. Bring your front-wheeled walker if you already own one or if provided by your surgeon. Please bring your shoulder splint if that was provided by your surgeon's office. The morning of surgery, you will arrive at the information desk in the surgery waiting area 2 hours prior to surgery. Please keep track of that. That's 2 hours prior to surgery. If you're late, it may result in your surgery being moved either to later in the day, the end of the day, or maybe a brand new day. So please do not be late. If you have questions and need to call for assistance, you may use the phone in the surgery waiting area. You will be escorted to the pre-surgery area where you will, I know everybody hates this, but you're going to get changed into a hospital gown, and yes, they're still open in the back. They will verify consent documentation, review your medical history, complete a physical assessment. You will speak with your anesthesiologist. Please be open with them and honest and ask any questions that you might have. You will have an IV placed and receive your preventative antibiotics. Please, again, this is very important, share any changes in your medical condition, such as fever, coughing, fatigue, headache, nausea or vomiting with your care provider and your staff. Please let the nurse know if you have been around anyone recently with any of these symptoms. During your surgery, please share with the family member or other coach who brings you to the surgery that there is a patient tracking monitor available in the surgery waiting area. They are always welcome to ask questions if someone is there. Your surgery will usually last around 2 hours. It could be shorter, it could be a little bit longer. Just depends on what your surgeon sees when they get in there. The doctor will speak with your family member following surgery. If your coach is not a family member, please let the doctor or nurse know so we can ask permission to talk with them after surgery. Time in recovery varies. You can be there up to 2 hours or maybe a little bit longer. Please visit our website at losrobleshospital.com to see the current visiting policy and hours. The day of surgery, when your surgery is completed, you will be placed into the post-anesthesia recovery unit, or PACU as most people call it. Your vital signs and incision will be monitored. You may have an IV for fluid, sequential compression devices or SCDs on your legs. It's kind of like a balloon that's going to inflate and deflate to help squeeze blood back to your heart, and waffle boots to prevent any type of skin injury. Ice packs will be utilized. A pulse oximetry, just to tell us how the oxygen is that's in your body, blood pressure cuff, and vital sign monitoring. If a Foley catheter has been placed, it will be removed as soon as possible. Your diet and activity are as directed by your physician and the Enhanced Surgery Recovery Program. There are some things, though, that we're going to ask you to do. Please avoid straws, as they intend to increase bloating and they can contribute to you feeling very sick after surgery. Chewing gum is encouraged, as it's going to help your stomach to wake up and get things moving. Walking will greatly assist getting your digestive system up and going after surgery. Your surgeon may administer pain medications, also known as regional blocks, during your surgery. This is going to greatly assist your pain management after surgery. Your surgeon will discuss this with you, as there are several different types of block that they can choose to administer. You may continue with a block known as an on-cue pump, which your nurse will discuss with you after surgery. This is all part of the multimodal pain management care regimen. You should expect some pain, discoloration, or swelling after surgery. You're going to be asked about your pain by many people, not just the nursing staff. But I'd like you to think about your functionality. That's your ability to do things such as going to the bathroom and walking. There are many pain relief options after surgery. Medications are some. The only time IV pain medication is needed is if you have a complication with your bowels, meaning your stomach. IV medications do not relieve pain any better than oral pills. Ice for incisional pain will greatly help with the swelling. Positioning and movement is what is really essential. When we get up and get our body straight, we oxygenate better, blood flows better, and you're going to feel better. If you are taking an opioid or pain medication, it's very important that you take your stool softener. Opioids slow down the way your gut moves, and the longer we have waste sit in the gut, the more water gets absorbed and the harder it gets. You will continue to take this when you go home if you're taking an opioid. This will help you avoid the dreaded constipation. Pain results from injury to skin, muscles, or nerves. Zero pain after surgery really is unrealistic. We cannot take away the pain completely because we have had to open your body to fix your body. A goal of pain management is at a level that allows you to be able to move, walk, and do your therapy. We will use a combination of pain medications, movement, and non-drug therapies. This is called multimodal. Let's look at a functional scale of pain. Mild pain, moderate pain, severe pain. In all likelihood, your pain will be in the area of mild to moderate. Mild because you're going to have the benefit of all of those interventions that happened during surgery. Moderate, as those interventions that happened in surgery begin to wear off, you will have to transition to management that will follow you home. Severe pain is very, very intense, and likely none of you will experience that during this stay. Let's talk about that nerve block again, just so that you can really see the benefit of it. This nerve block results during intraoperative, meaning your surgeon is injecting directly into those injured tissues during surgery. You may continue that with a pump afterwards. And guess what? This is really good. These will last up to 3 days. Goal is in the moderate range, remember, 4 out of 10. We need to talk about opioid safety. No alcohol, no driving while you're taking an opioid. And even though it's a prescribed, taking an opioid and driving is still driving under the influence, and you can be arrested for that. Please keep your medications out of the reach of children and pets, and they must be kept in a locked area. Safely secure all opioid medications and dispose of unused medications once you're home. There are many disposal areas that you can bring your medications to. Most sheriff's departments have a box that you can drop them in. Do not flush them down the toilet. These medications then travel out to our water supply, and they're just not good for the community or for the oceans. There are many side effects of opioid medications. Constipation, which we already talked about, and why you're going to take your stool softener as long as you're taking an opioid. You may have itching. It may interrupt your ability to be able to go to the bathroom and pee. Nausea, you may feel low blood pressure, and it might even impact your breathing. Again, please take your stool softener. We need to get up and move. Your physical therapist, your nurse, your surgeon, everybody is going to tell you that. And it may seem like we're saying this many times, but we are saying this many times because to help you understand, this is really what's going to get you better. Ice on the incisional site. You may have a machine or an ice pack. Remember, 20 minutes every hour, but you got to place a barrier on your skin so that you don't damage the skin. Relaxation techniques. If you're familiar with meditation or deep breathing, will be very effective in helping you in your recovery. You can use music or other distractions, such as TV. Let's look at the diagram here so that we can really have a realistic expectation post-operative. We all come into the hospital and we're here to fix something, so we're not exactly at our best. We're going to have our surgery, but to think you're going to jog right out of here really is very unrealistic. If you do your therapy, walk consistently, follow any precautions if you were given them, manage your pain, and put in the time, then it is realistic that eventually you will return to your same active self. Each of you will be visited by a physical therapist the day of your surgery, and they will see you a couple more times before you go home. You may or may not have an occupational therapist. Remember, anyone on the unit can get you up, which means your nursing assistant, your nurse, the physical therapist. The physical therapist will evaluate you. And as part of our rapid recovery program, you will be seen morning and evening on your first day after surgery. Remember, you will get out of bed and walk the day of your surgery. If you need an occupational therapist, their goal will be to help you prepare to go home, and they will assist with such things as dressing, taking a shower, going to the bathroom, and any household activities. We have therapy goals while you're in the hospital, but what is key is you must participate. In an ideal situation, it's great to have your coach and family members present when you are having therapy so they can learn how to assist you. However, at the present time, visitors are not allowed on the units, but we can assist you to FaceTime with them. You're expected to put on your clothes and shoes. Remember, you are not sick. It's expected you'll sit in the chair for your meals. Again, likely you do not eat your meals in bed at home, except maybe some popcorn once in a while. And we are preparing you for a return home. Walk to the bathroom and around the nurse's station. But please remember, give us a call. Do not fall. It's always good to have someone standing there just in case you start to feel a little dizzy or uneasy so that you don't have an accident and fall. Let your therapist know if you have stairs either getting into your home or inside of your home, they're going to practice this with you. Please learn about any precautions and exercises. I want to emphasize again, calling for assistance. Please call, do not fall when you need to get out of bed for any reason. During the nighttime, it's dark, it's not your usual room, so it's very easy to get disoriented. Please avoid bending if you drop something. Give us a holler and we'll come help you. Certain medications will increase your risk that you could fall. Things such as the anesthesia you had during surgery or pain medications you may be taking. Some of the furniture in your room is on wheels and should not be used for support. That could contribute to you falling. Things such as your bedside table or the IV pole. There's some equipment that you may or may not use after your surgery. You may have a front-wheeled walker to assist you in being safe as you ambulate and to be able to balance appropriately so your new joint will work as well as the other one. You may have a cane. You may be given a bedside commode, however, very unlikely, because our goal is that you're going to get up and go to the bathroom. You may have a knee immobilizer. If your surgery is a posterior hip replacement, you might have a special pillow to prevent your hip from going in the wrong direction. You will be given an ice machine that will place ice onto your joint. Understanding, ice is very good at decreasing inflammation. However, we can't keep it on forever, and you got to get up and move. The sequential compression device, or SCDs. These are those funny pumps that squeeze your legs to help the blood get back to your heart after surgery. However, when you're up and moving, the muscles in your legs will do this job and you will no longer need these. Other things you may see is a reacher or grabber. If things are inaccessible to you easily, please ask about these devices. We do not want you to go home and stand on a chair or try to tiptoe and reach something that you cannot get. You may need a long-handled sponge to help you with your bathing or a shoehorn. There are also aids to assist you with things such as pulling your socks on. These types of kits are available for purchase. You can get them online or any medical supply store will have them. We're going to communicate with you while you're here, and you will see a communication screen in your room. There's going to be telephone numbers so you can get a hold of your team. We will list the last time you had a pain medication. Please use your call button to reach your care team. We're happy to come and help you. You're invited to let us know how we're doing. If at any time you feel upset or you're not happy with the care, let us know immediately. It's our goal to provide you with an exceptional experience, so we want to be sure that that happens. You can develop complications after surgery, so we're going to do our best to prevent those things from happening. They're rare for total joints, but education and compliance on your part is the key to prevention. We want to prevent infections. That's why we do the cleansing before your surgery. Your incision will have a dressing on it. You will be given antibiotics, and number one, we're going to wash our hands. Blood clot prevention. The number one way to prevent a blood clot is to get up and get moving. Until you're moving fully, you will need to have those squeezing devices on your legs. So if you don't like them, you got to get up and move. Also, doing your ankle pump exercises will be so beneficial. We want to prevent pneumonia, so you will be given an incentive spirometer. You will be instructed on how to use that. Also, doing coughing and deep breathing exercises, plus getting up and moving. When our body is upright, our lungs fully expand and we're able to move fluid easily. You might receive 1 or 2 more doses of antibiotics after your surgery, depending on your surgeon. Infection of your new incision is a risk until it fully heals. Anyone touching the surgical incision must always wash hands. So even if somebody's taking a peek, be sure that your hands are always washed. In all likelihood, you're going to have a dressing that will not be removed until you go to see your surgeon at your post-surgery visit. Staff and guests must wash their hands or use hand sanitizer while entering and exiting your room. If they don't do that, please kindly invite them to go back to the door and do that. Do not put any ointments on the incision. Please, if you go to your dentist, let them know you recently had surgery, and also so you can plan any future dental work. Let's look at your incision. You need to look at it every day. Now understand, like we previously said, you likely will have a dressing that will not be removed until you see your doctor at your post-operative visit. But pay attention to that dressing. If you see that it becomes heavy or there is drainage that you can look at that's getting bigger underneath, you need to let your surgeon know about that right away. Or if it starts to smell bad, time to give them a call. Please do not pull off any tape or glue. You might have a combination of any of these types of sutures or wound closures below. You could have an actual suture. You may have steri-strips. You could have some staples or glue. It just depends on what your surgeon chooses for you. Again, do not pull on these incisions. Keep your dressing clean and dry. If it becomes wet, you will need to take it off. Do not apply to your incision any lotion or antibiotics. It may itch a little bit because as the skin starts to heal, it gets tight. Again, do not remove or pick at staples, sutures, steri-strips, or glue. Here's some things that you do need to report to your doctor. If you have increased redness or other discoloration, if your incision becomes hot when you touch it or you have pain and tenderness, if there's drainage under or leaking outside of the dressing, a foul smell, or presence of pus. If you look at the incision and it is pulling apart, or you have a fever, please know a fever is often one of the last symptoms of an infection. So our goal is, if anything is not right, we want to catch it before that time. Let's again talk about decreasing your risk of pneumonia. The incentive spirometer will go a long way to do that, and you get to take it home with you. You need to limit the time you're lying flat in bed. It's much better to get up and get moving, again, because our lungs expand better when we're upright. Sit in a chair, do deep breathing exercises, and again, move around as much as possible. If you have problems with your lungs, such as any pre-existing condition, it's critical that you discuss this with your doctor and you use the spirometer to reduce your risk for pneumonia. Let's review blood clots. What causes them? They can be a complication from any type of surgery. What contributes significantly is prolonged bed rest or inactivity, meaning you've got to get up and move. Your leg muscles will help to squeeze all that blood in the lower part of your body back up to your heart and get your circulation moving the way it should be. Signs and symptoms of a blood clot are you may have swelling in your affected extremity. There may be tenderness or pain in your calf, and it becomes very warm to the touch. It is important that you notify your surgeon immediately if you have any of these signs and symptoms. You may be given anticoagulation therapy. Take your medication when home. Usually, this may be stopped prior to surgery and started after surgery. There are side effects to anticoagulation medications, such as diarrhea, nausea. Some people get a funny metallic taste or bleeding. You must report to your doctor any bleeding that will not stop, any unusual bruising or growth in the size of a bruise, if you have blood in your urine or you vomit or your poop. Blood that is moving is less likely to clot. Therefore, again, be mobile. Get up and moving. Wearing the SCDs or the sequential compression devices will help you while you're in bed at the hospital. But again, get up and move. Pressure ulcers. This is an unlikely injury, and most often when it does happen, it happens on the heel. It's an injury to the skin or the tissue, usually over a bony area. They are the result of pressure to the area, such as if you don't move and your heel stays on the bed. There are signs and symptoms such as redness, bruising. You may get a blister or maybe pain. It might be warm or cool if you compare it to the other extremity. Please keep your heels up and do not keep on stockings. Oftentimes, if you do not remove hose, there can be something going on underneath there that you don't see until it's too late and it really becomes a problem. Use a pillow or a towel underneath your heel to kind of float it so that it doesn't rub on your bed. You can ask for help to take a look at your heels. It might be hard for you to be able to see that, so please ask a family member or a friend just to take a peek. You have to look. If wearing compression hose, remember, you must take them off and leave them off for a minimum of 1 hour. You might have a trapeze in the hospital to help you while repositioning. Likely not. All of these things are critical for diabetics who already have compromised blood flow and oxygen in their tissues. So please be careful. Here's some basic nutrition tips. Choose fresh food instead of processed foods. You got to eat a lot of protein. Protein is what your body needs to heal, and it needs a lot of it after your surgery. If you're going to snack on fruits, nuts, seeds, fresh vegetables, things like trail mix. If you have high blood pressure, a low sodium diet is recommended. Eat foods high in iron so that you can avoid any anemia associated with your surgery. It's good to avoid deep fried foods and eat less fatty red meats. Again, drink plenty of water. Dehydration occurs when you don't have enough. Even mild dehydration can drain your energy and make you tired. When we're tired, we don't move. When we don't move, all of those other complications we talked about become a risk. Let's discuss getting you out of here. Here's what will get you home. You have to be moving safely. That can be with an assistive device. You need to be eating and drinking well. You have to tolerate your oral medications, including pain relievers and anticoagulants. You may go home with your nerve block in place, going to the bathroom without difficulty. You must urinate or pee before you go home, but, and this is a biggie, you do not have to poop. Please feel welcome to pass gas, though. Planning for your discharge is very critical. We expect that you will go home the day after your surgery. Based on your medical condition, your doctor may decide after surgery you might need an additional day. However, be prepared to go home as planned. The case manager will create a plan that is specific for you, and you will be given a checklist. Insurance coverage may determine any discharge options that you have. Here's what your doctor needs you to do. You must notify your doctor immediately and seek medical attention for any of the following. Increase in pain that is not relieved by medication or rest. Any numbness or tingling or weakness you feel. Fever above 100.9 degrees. Pain, swelling, tenderness in your calf. Please call 911 immediately for sudden onset of chest pain and or any shortness of breath. Your coach has a job too, so let's talk about the role of your coach. Please designate someone such as a spouse, a family member, a child, a sibling, a best friend to be your coach. Your coach provides motivation and encourages you to do the things that you're to do to get better. Your coach will help you remember any precautions if you were given them. Your coach is going to assist you with exercises and understanding your discharge instructions. They can even help with things like picking up your prescriptions and help to prepare your home after surgery. Please ask for their assistance the first time that you are going to go into the shower. This is very important. We do not want you to go home and have something happen, such as a slip and fall in your shower. They will also help you with any meal preparation, and they can take you home and to your follow-up appointments. Let's prepare your home to be safe. Overall, move the cords and throw rugs away from pathways. I know you all have them. I have them in my house. Use stable chairs with armrests and avoid low, soft sitting surfaces, such as that lazy boy. Be aware of where your pets are. People will do tremendous things to avoid falling on their favorite pet. Ensure that your stairways and paths have good lighting. You may think you've gone up and down your stairs 100 times and you'll know where that next stair is, but it's all a little bit different after surgery. And please make sure items are easy to reach. In your bathroom, remove the rugs and the bath mats. They look very nice, but they are a significant trip hazard. Please use skid-resistant strips or rubber mats instead. We may recommend a toilet seat riser and a shower bench to assist your safety. In your bedroom, have clean pajamas and sheets. Please have a lamp and phone within reach. Do not increase the height of your bed, and keep a clear path to the bathroom. Tuck things out of the way that might create a fall hazard. It's also good to have a few night lights around. Again, you may have lived there for a very long time and think you remember everything, but it's all very different when you're recovering from your surgery. In the kitchen, please store frequently used items at waist level. It's your house. Feel welcome to put anything on the counter you want. Stock up on easy to prepare foods. It's kind of good to plan your meals because that will help you. Showering only. Please, no baths. It's very difficult to get up and down in that bathtub, and also it's not a good idea to soak and have soap into your incision. 48 to 72 hours after your surgery, you can shower. Cover your dressing. Your dressing will be waterproof and will be removed by your doctor at your first visit. However, it's a good idea to maybe put a plastic bag or some wrap around it. Please, again, have a family member or friend help you in the beginning. They can assist you in and out of the shower and be waiting for you when you're done. Do not swim, take baths, or go in the hot tubs for a few weeks until your incision is healed. That means it's completely closed and you've cleared this with your surgeon. It's important to remember your precautions. We all want to get back to the normality of our lives, and driving is part of that. But please talk with your doctor first. Do not drive if taking pain medications. Again, that is a DUI. You must be able to make an emergency stop and operate the machinery safely. Driving will depend on leg position, strength, coordination, and which surgery site is affected. Most people are able to drive within 2 weeks, but for some of us, it might take as long as 6 weeks. Returning to work is very important, and in all likelihood may be the reason you had your surgery. You must follow your doctor's direction. For most people, it's about 4 to 6 weeks. Your speed of recovery depends on your condition before surgery, after surgery, and how well you followed orders and participated in your home program. Also may be dependent on what type of work it is that you do. Let's hit a subject that most don't want to talk about, but hey, it's on all of our minds: sexual intercourse. Please use pain as your guide. Most people are usually able to resume their sexual activity after a few weeks. This is a part of what makes us human and is very important in our lives and in our relationships. Please do not feel embarrassed and feel welcome to call with any questions. Discuss this with your partner. If you experience pain, stop immediately, and you know what? You can try again on another day. Remember your precautions if you were given them. There's many resources that can assist you with this, and you're welcome to visit any of them, such as the recoversex.com. Physical therapy, nursing staff, and your physician are going to be monitoring your activity level following surgery and at every visit you have. Home health and eventually you will transition to outpatient physical therapy, will be very significant to getting you back to where you were or where you would like to be. If you need more information, you're very welcome to visit us at www.losrobleshospital.com, or you can holler at the Total Joint Hotline at 805-370-4694. It's right there in front of you. You can write it down. I'll be glad to answer any questions you have. So I hope this was beneficial. Please know that you can go backwards and pick up any additional information. You can look at it as many times as you want. Write down your questions, and we're here to help you. Take care. Have a beautiful day.